Okay, so today we're going to be doing a sidelying drape. We're going to be talking about pillowing. So I'm going to show you what pillows are going to be in pillowcases and where those pillows go. We're going to be doing a high glute drape. We're going to be doing a back drape, an arm drape, and a lower leg drape. So we're going to go over all of that today. Okay, so I'm just going to get the camera over here. So I have 3 pillowcases. I told you guys to bring 3 pillowcases. Obviously we're not going to be in class, so that's why I'm going to do this video for you instead. So I have a thin pillow in one pillowcase. I have a little bit of a thicker pillow in another pillowcase, and then I have 2 thick pillows in one pillowcase. I might have to add a third. If I need to add a third, I'm going to slide it in between these 2, okay? It depends on how high our patient's hip is going to be, because we want that to be level. I need to see what's going on there, okay? And for the pillow that has 2 pillows in it, I want to tuck the ends of the pillowcase like this, okay? And then I want to make sure that this is the side that goes to the inner thigh on my patient, okay? I have 2 cervical pillows wrapped. One is going to go under the ankle of the lower leg. Another one might be needed to use for the neck, okay? So I'm going to pre-wrap these in case I need them. I also have an extra pillow here without a pillowcase, and I'm going to show you guys if I need to elevate that hip and I don't have an extra pillowcase, I can also use this under the sheet. I'm going to show you how to do that, okay? All right, I don't need the face rest, okay? I'm going to get rid of that, okay? So I'm going to get my patient to start on whatever side that they want. However, if they have a shoulder injury, I'm obviously going to get that side up, okay? Do you have any injuries or anything like that? Okay, so maybe we'll get you on your right side so your back is facing me. Okay, perfect. Okay, so I'm obviously going to pillow the neck and shoulders first. That is where my little bit bigger pillow is going to come in, okay? So I'm going to put that there. I'm going to make my patient comfortable, okay? Now what's really important is I want to use the whole table, okay? So I need my patient to be right on the edge. So what I like to do, hold on, is I like to say, please lean back or slide back until your hip hits my hip. So I'm actually like guarding the table. So come back towards me until, perfect. So they come into contact with my hip, they're at the end, they're not right at the edge, but they're at the end because we need to use the whole table, okay? So, Adam, it's okay if I just undrape your legs? Yeah. Okay, so I'm just gonna show you what the legs are gonna look like here, okay? This lower leg is gonna be straight, and the upper leg is gonna be bent in a 90-degree angle, okay? So I'm obviously gonna put a pillow here because I want this hip to be flush, okay? So this hip is a bit far down, okay? So I'm gonna use my really big pillow here with 2 pillows in it, right? I've tucked this part in. This part is gonna go towards the feet. This part is gonna go to the inner sides, the insides of the legs here, okay? So I'm just gonna place the pillow on the table like this. I'm gonna undrape to just above the knee, and just like Keith showed in the video that you guys watched, I'm gonna reach under, and I'm gonna grab this pillow with the seam end going to the inside of the legs, and I'm just gonna pull it up, okay? This patient has a really tall leg, so I actually need to use another pillow to support his ankle, okay? So I have another pillow wrapped in a pillowcase, and I've just folded it in half, and that's gonna pick up the slack because we can't have his ankle floating around in space here, okay? So I want this to be in a 90-degree angle, and I want this to be even. So if Omar can just kind of show us, this is pretty good. I'm gonna leave it like that. I think that's a good angle for the leg there, okay? So here, we have this joint that's kind of hanging out in space. I can put a rolled up towel, or I can put a cervical pillow underneath here, okay? And we've pre-wrapped this. All right, it's not going on the foot to increase that plantar flexion. It's actually gonna go in the joint so that ankle is able to relax in a neutral position there, okay? And finally, I have to give the patient what I like to call a huggy pillow, okay? So this shoulder is collapsed, it's not feeling very supported. We're also stressing the back here, so we can take a big pillow, fold it in half, and I like to pass it under the sheet and tell the patient to put it up against their body like this. So they're gonna hold it like this. This is also going to create a barrier for any type of breast tissue exposure. Our patients are able to hold this and create a boundary of security there, okay? So I'm usually going to put this side in and pass it to the patient like this. Okay. All right. Do you feel comfortable?
Yes.
Okay. So what we need to look at is the angle of the spine, okay? So I'm going to get Omar to come over here. So I need to look at his back and make sure, so his spine looks straight, but his neck is kind of collapsing a little bit in that angle. So that's why I have my other cervical pillow folded, and I'm just gonna pop that in there, and that's actually making that into a nice neutral area, okay? Sometimes the patient will have this shoulder forward and this shoulder back. That obviously doesn't look the best. So we're gonna make sure that they bring this shoulder towards the back of the table. Perfect, okay? And now we have a nice straight line here. Adam, do you feel comfortable?
Yes.
Do you feel supported?
Yep.
Okay, perfect. Okay, and then finally, what we always need to do is use a body drape, okay? So we actually need 2 towels for this drape. So I've got my other towel here. I'm gonna put that over my shoulder, ready to go. Okay, so I'm gonna show you the easy drape first, which is gonna be the back drape, which may or may not include the arm. We're definitely gonna include the arm just to show you guys, pardon me, what's going on, okay? So I'm gonna turn the towel this way, because I'm obviously gonna be using the same draping boundaries, which are, you know, our PSIS, okay? So I can feel where that is. First things first, for every drape we're doing in sidelying, I need to tuck under the glutes. I need to secure this area. This is the most important area I don't want to expose, okay? So I've tucked under there. I can feel here. Is it okay if I tuck into your undergarments?
Yeah.
So I'm going to tuck into the undergarments, and I want you guys to watch. This is really hard. This is really complicated. I'm going to take this corner, and I'm going to fold it back, okay? If I was not including the arm, all I would have to do now is create that right angle and tuck this in. Okay, I will take the towel and I will secure with the towel, and I have the back drape, okay? So because the body is a bit higher, we're gonna wanna maybe drop our table down 1 or 2 a bit lower than we normally would, because we're actually treating a bit higher, right? Normally our body would be here, so we might wanna drop that table down 1 while we're doing the sideline, okay? So obviously, our biomechanics are gonna be a bit different. I'm always in my lunge stance, okay? But my body's gonna be angled a little bit, okay? Adam, I'm sorry, my hands are freezing cold. Okay, so this is what my effleurage is gonna look like. I can do palmar stroking. I can treat both sides of the back, right? I can do my palmar kneading. Okay, I can do my reinforced. I can do some knuckle stroking. I can even do some ulnar border. All of that stuff can be done in here. We obviously know if we're working at muscle depth, I can go in either direction as long as my starting and finishing strokes are back to the heart. So I do really like to treat in this direction. I can stabilize on the shoulder. I can do some stuff on the low back here. I can do some kneading. I can do some knuckle stroking. I can do some ulnar border, all of that stuff, okay? If I want to incorporate the arm, okay, so moving on to the arm drape, what's going to happen is I'm going to leave the back undraped because we're just going to add to it. So Adam, I'm going to get you to bring your arms straight up over your head, okay? So I'm going to bring that, and I'm going to get Omar to come around to the front. Okay, so Adam's arm is straight up over his head. I'm going to take this sheet, I'm going to bring it down, and I'm going to get him to lift his face up, and I'm going to tuck this under his chin. Okay, so this huggy pillow is a little bit in the way. So basically what the chin tuck is doing, it's creating a barrier in the front to secure the breast tissue, okay? Now when I bring the arm down, it secures it under the axilla. So if Omar comes over here, he can see, obviously it's loose here, but we have the barrier of the pillow in the front, and now I can roll this, and I can actually create a really secure drape, and I'm going to tuck that in here. It looks a bit loose, but it's actually quite secure, and a woman's breast tissue is usually going to fall forward, instead of away, so we can actually do lots of really good work in the shoulder. I can mobilize it, but the one thing we don't want to do is pull the patient's arm back, okay? That's what's going to create a gap in here, and that's what's going to create a bit of insecurity for our patient. So we're working in this plane, we're just not pulling our patient back for risk of exposure, okay? So I can definitely do some good stuff in the pecs, I can treat the rotator cuff, I can treat the deltoid, I can treat the traps, I can treat the whole arm, okay? So we're gonna be doing muscle stripping and frictions in the side-lying position. In this position, we're able to treat supraspinatus, infraspinatus, deltoid, triceps, common extensor tendon, all of those areas. And later on, I'm gonna show some muscle stripping to the deltoid. We also have a video of circular frictions here, okay? So to redrape the back, I'm going to pull this out. I can leave the patient's arm out, or I can put the patient's arm back in, okay? Adam, would you like the arm out or in? Out, okay? He wants the arm to be left out. So basically what I'm gonna do is I'm gonna tuck under here and I'm gonna secure this drape, okay? So I'm actually noticing he's collapsing a little bit, so I just want that shoulder to be brought out. Perfect. Okay, so I've already asked permission. Now we are about to do a high glute drape, okay? So this is the complicated part of the drape. Hopefully you guys watched that video with Keith. I'm just gonna be doing a little bit more in depth and hopefully a little bit of extra angles for you guys to help you, okay? So just like when we're undraping the leg, maybe I'll get Omar to come over here in the front. So maybe I'll stand on that side. Yes, perfect. Okay, so the difference between this drape, it's very important. I'm not taking any of the sheet from the top, okay? So this is gonna be a little bit different than when we undrape the leg and we pull all the way up and we pull really close to the hip. I'm gonna be doing little pulls and I'm gonna be taking all of the sheet from the bottom, okay? I really need to be cautious because I don't wanna increase the gap here, okay? And when we do a sideline drape, we actually need to create a fan in the front here with the material from down here, which is gonna create security for our patient in the front, okay? So just like our leg drape, I'm gonna undrape above the knee, but I'm not gonna create that 90-degree angle. I'm just gonna go above the knee and have that outer edge available, okay? I'm going to support the leg in the crook of my elbow and my palm. I'm going to lift up and I'm going to pull, 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 okay? And I'm gonna push above the knee, okay? What's really important is that I do not twist this fan here, okay? I'm gonna show that again one more time. So I'm going just above the knee. I'm having this outer edge available. I'm lifting the leg and I'm pulling, 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 and I'm pushing up, okay? So if we look, I have both of the corners of the sheet that was down here, okay? This part is very important, okay? So I pulled this through. The bottom is gonna make the fan bigger. The top is gonna make the part around the upper leg here tighter, okay? So if my fan isn't twisted, I'll be able to pull the bottom and it will be bigger, okay? If it's twisted, if I pull here, it won't go anywhere. You might need to untwist this fabric, okay? So because I could potentially have a gap here, I have to spread this fan out to create some security for our patient, okay? So I'm gonna push it up a little bit, spread that out, I'm gonna tuck it under the towel, and from here, I'm gonna shimmy up the leg to about here, okay? I can't hold this tight, okay? If I hold the fan and this part tight, I'm not gonna be able to go up here, okay? So I have to allow a little bit of that sheet to open up, okay? If this fan is getting small, I can pull the bottom and make it a little bit bigger. Okay, from here, we're gonna go for a high glute drape. I'm gonna take both of these and I'm going to shimmy, shimmy, shimmy. Is it okay if I tuck into your undergarments? Yep. Okay, so if you notice, I have a lot of bulk here, okay? So just like when we're doing the other drapes, I need to pull this bulk away, okay? The less bulk I have to deal with, the tighter and more secure my drape is gonna be. Okay, so pull, pull, pull. Okay, maybe a little bit more, just because I'm a bit of a perfectionist here. Okay, so I'm gonna tuck into the undergarments and I'm gonna scoop up. Same draping boundaries as before. We have the ischial tuberosity, the lateral sacral crest, and the PSIS here, okay? Well, our iliac crest, not necessarily our PSIS. Okay, so from here, I'm gonna take these two. I am going to tuck, tuck, tuck. Now I'm gonna tuck and roll, tuck and roll, tuck and roll, tuck and roll. Okay, now I actually have a really, really, really tight, really secure drape, okay? I have my fan here covering. I'm gonna take my towel. I'm gonna secure in the area where the sheet came together. That's the most vulnerable area for the sheet, okay? I'm gonna tuck that in right there. I'm gonna secure this under the glutes back here. And I'm gonna take the rest of the towel and I'm gonna tuck it under the leg that's on the pillow here, okay? So we actually have full coverage here, no exposure. The towel is securing. Do you feel secure?
Yeah.
Yeah, it's really tight, okay? To take this drape out, I have to leave the towel here, okay? The fan is creating coverage in the front. When I undrape this, I'm gonna be taking the fan away. So it's really important that we leave the towel in place, okay? So I'm gonna pull this down. I'm gonna leave the towel here. I'm gonna take the fan away. And I'm gonna pull this down and make sure our patient is fully covered. Okay, and finally, the last drape to do in Sidelying is gonna be the lower leg. So again, we're gonna undrape to the knee. It's gonna be hard for me to lift the leg up, so if I wanna lift it, I can bend it. And just like I did before, I'm gonna have that leg resting on my forearm, and I'm gonna pull all the way up. Pull this and kind of shimmy up, okay? If we can't get this high enough, what I can do is, Adam, I'm gonna get you to reach under and I would like you to pull the inside of this drape as high to your inner thigh as you can. You can do it, right here.
Bottom arm?
Top arm, top arm. No, go in the sheet, yeah, yeah, there you go. Okay, and pull it up, perfect, beautiful. Okay, and our patient interacted with that, and that might also create some security in that area, okay? So we have a nice high drape, and our draping boundary is just like the leg, it's the ischial tuberosity. So I'm just gonna make sure that that ischial tuberosity is exposed, okay? So if anything is coming out, I can use my extra towel here to create some warmth and some coverage there, okay? And just like any other drape, I'm gonna pull this part down, make sure that's covered. I'm gonna bend the leg to lift it, and I'm gonna bring the drape around. And I don't need my towel on me. I'll pull this out, and I'll do that. Sidelying drape.